One of these patients is a good candidate for under-eye filler. The other one will regret it for years. Can you tell which is which? Take a second, really look. Because most people, even some injectors, get this backwards. By the end of this video, you're gonna know exactly why, and you'll know the one question you need to ask before anyone offers you under-eye filler. That single question can save you years of trouble, not to mention thousands of dollars. I'm Dr. Kian Eftekari, oculofacial plastic surgeon at the Eyelid Center of Utah. My entire practice is the eyelid area, upper eyelids, lower eyelids, and the structures around them. I see patients who have had filler under their eyes multiple times per week. Some of them come in happy with it and just want to know what their options are for surgery down the line. But most folks come in confused, disappointed, or looking for someone to tell them honestly what went wrong. This video is for that second group. Let's start with the basics, because filler under the eyes isn't a terrible idea in theory. It became popular for a real reason. The tear trough is the groove that runs from the inner corner of your eye down toward your cheek. As we age, the tight barrier holding the under-eye fat back in your eye socket kind of thins out, so the fat pooches forward and that groove under the eye and under that fat appears deeper. You get a shadow that reads as a dark circle even when you're feeling perfectly rested. And the idea behind filler is logical. Just fill in that space. Think about it this way. You've got two hills, the fat bulge under your eyelashes and then your cheek fat, which has more fat than the skin under your eye. In between these hills is a valley. That valley is known as the tear trough. Think like a trough that horses drink from. The trough can be narrow, just this inner third, or wide all the way across the eyelid. So if you fill in the valley between the two hills with a gel-like substance like filler, that seems like a pretty good solution, right? It's quick, low downtime, reversible. If you do this in the right situation, the results really can be nice and immediate. The problem is that the right situation is much rarer than the cosmetic industry will tell you. There are three ways that under-eye filler fails, and once you know which one you're looking at, your path forward becomes more clear. Failure number one, overfilling and migration. The first failure mode is the one almost nobody warns you about before you get filler in the first place. I need to tell you something. I have dissolved filler out of people's eyelids that was put in 9-10 years ago. Filler is marketed as temporary. That marketing is not exactly lying. It does lose its projection over time, but temporary is doing a lot of work in that sentence, because what I'm pulling out of these eyelids isn't just leftover product, it's product that's been sitting there for a decade, slowly changing the shape of somebody's face in a way that they never really agreed to. And this is so common that when I ask patients if they've ever had filler before, the first answer is almost always, no, oh gosh, no. Then they remember, and they start thinking, then they wave me off. Yeah, but that was years ago, it's all gone now. It is not all gone now. Under the eyes specifically, filler can sometimes resorb really slowly. Sometimes it can persist for years. It can get encapsulated, and then there's sort of a capsule around it, and it gets sort of stuck there. The thicker products that absorb water are the worst offenders. So what happens when a patient comes back for a touch-up every year and nobody is checking on how much product is still present from their previous sessions, and another syringe just goes in on top of what's already there, layer by layer, year by year? Eventually what happens is the lower eyelid just takes on this round, puffy quality that just doesn't match the rest of the face. The problem is patients are often told to just keep adding more when what they actually need is a clean slate. The takeaway here, filler isn't as temporary as you've been told. If you've had it more than once or twice, there's almost certainly more product still in your face than you think. Failure number two, the wrong diagnosis. This is the big one. This is the reason filler fails more than any other. It's not a technique error, it's not which filler brand you used, although there are some bad ones to use under the eyes. The reason is simpler than that. If your under-eye problem wasn't just a little hollowness in the first place, then filler was never going to be the right solution. I think of this as a structural question. If you have under-eye bags, meaning fat that normally sits behind the eyes, pushing forward through that weakened tissue called the septum, and it's creating a bulge under the lower eyelid, then the bottom line is you should not get filler. Period. End of story. Here's the tricky part. eye bags and hollowness can look remarkably similar in certain lighting and in photos. So now let's go back to where we started with this video. One of these patients is a good candidate for under eye filler. The other is a terrible candidate. In my opinion, filler is appropriate for the younger patient on the left, the one with a more subtle under eye darkness, not a hard step off, not a harsh shadow. The other patient, the one with a more dramatic step off, is a setup for failure with filler. I want you to hear this clearly. Filler does not fix under eye bags. In a lot of cases, it makes the whole area look puffier, heavier, and more unnatural than ever before. And because the shadow is still there, because the bags are still there, the dark circles don't really go away either. This misdiagnosis happens constantly, and it's not always the injector's fault. The distinction genuinely requires a hands-on exam and a trained eye for eyelid anatomy. But it is the number one reason I see patients walking into my clinic saying that filler just didn't work. The takeaway here: if the problem is structural, no amount of filler is going to fix it. It can only make it worse. And eye bags and hollowness can look almost identical in the wrong lighting, even to a trained injector who isn't an eyelid specialist. Failure number 3, the Tyndall effect. The third failure mode has a name that sounds more like a physics lecture, and that's basically because it is. The Tyndall effect is what happens when filler gets injected too close to the surface of the skin. The skin under the eyes is some of the thinnest in the entire body, so when filler sits right underneath it, light scatters through the gel in a very specific kind of way that gives off a bluish-gray discoloration. So if you've been living with what looks like a chronic bruise under your eye, or if your dark circles somehow seem worse after filler, then this might be what you're dealing with. The good news is that this one is mostly fixable. Hyaluronidase is an enzyme that dissolves hyaluronic acid filler. 1 or 2 sessions, it can break the product down and the discoloration gets better. It's not that complicated of a fix. But not all fillers are made of hyaluronic acid, and you do need someone who knows what they're looking at to identify it correctly first. The takeaway is, if the filler made your eyes look bruised instead of brighter, the filler is sitting in the wrong layer of the skin. It's fixable, but only if somebody identifies it first. Okay, so now you've recognized your situation in one of these 3 failure modes. What do you actually do about it? Let me walk you through each one. If it's overfilling or migration, the first step is just dissolve it. But here's what I want you to hear clearly. This situation is not your fault. You didn't ask for too much filler. You went back for touch-ups because that's what you were told to do. The failure here is the model of care that prioritizes repeated sessions over simply just reassessment. A good injector stops and says, let me check what we're working with here before we add anything else. Not every injector does that. Once the product is dissolved and you've waited a full healing cycle, which can take 2 to 4 weeks, you can then come back to your baseline. From there, if you were a good candidate for filler to begin with, smaller amounts of precisely placed filler with proper evaluation first can still give good results. The slate is clean. You're not starting from behind anymore. Now to our second failure. If it's a misdiagnosis and you have eye bags and not hollowness, again, the first step is dissolving whatever filler is there. You need a clean baseline before I, as a surgeon, can evaluate properly what is actually going on structurally underneath all that filler. Once that's out and everything is settled, usually a few weeks, then it's time for a real evaluation. If the problem is fat prolapse, filler was never going to solve that. The procedure that actually addresses that is a lower blepharoplasty, surgery to reposition or remove that bulging fat and possibly address the skin. Now, I've got a full video on why skin pinch approaches alone can get you into some trouble, and I'll link that below. So remember, it's often skin and fat. So let me say this clearly again. Filler is not a primary treatment for eye bags. And if you try to take that shortcut, you'll end up taking the long, expensive, and sometimes painful route before eventually ending up in my office doing surgery anyway. Bad idea. Now, if it's the third failure, the Tyndall effect, hyaluronidase, just dissolve it. Most fillers take more than 1 session, and this is the part that people don't do. Reassess whether you actually needed filler at all. Once you take away the bluish edema, the puffiness, sometimes you realize that a structural problem was hiding underneath the whole time, something that filler was never going to fix. Now, I want to come back to something I promised at the very beginning of this video. The one question you need to ask before anyone ever injects filler under your eyes. This is the most useful thing I can give you in this entire video, so if you learn nothing else, please understand this. Before they even pick up a syringe, ask your injector this. Based on my anatomy, how many syringes of filler would you need to correct just the area under my eyes? This question is a litmus test. Listen carefully to the answer. If your injector says they need more than one syringe for just the under eye area, that might be a red flag. And I'm talking one syringe total for both eyes. So half a syringe per eye is the max that I would recommend in one session. Here's why. If you were a good candidate for filler in the first place, your tear trough would just be a subtle dip, a little hollowness, the kind of thing that takes a small amount of product to help flatten out. One syringe or even often less. If on the other hand, and this is what I see every week, you have a deeper dip in the road that would take more than one syringe to fill, by definition, you have a problem that filler cannot fix. Not now, not with more sessions, not ever. You need to be looking possibly at surgery or fat transfer or ideally both. Do not let anyone inject more than one syringe of filler under your eyes. You will regret it. And this question, this one question, is also the answer to that visual test that we started the video with. The right patient for filler needs just a little. The wrong patient for filler needs a lot. If your injector is asking to put a lot of filler in, then by definition, you are not a candidate for under eye filler in my more than 10 years of experience. One more thing, because this comes up all the time, it feels kind of awkward to bring up. If you need your filler dissolved, do you go back to the person who originally did the injections or do you go to somebody else? Honest answer, either can be right. Good injectors dissolve their own work. A skilled, honest provider who did your filler and knows your anatomy might actually be the best person to fix it. Going back isn't an admission of defeat on your part, and it's not necessarily an indictment of them. You should pay them for their services. Filler issues happen even in good hands. But if you go back and the injector tells you that your results look fine, when you can see that they don't, that's a problem. If they suggest adding more filler to fix a filler problem, that could be a bigger red flag. And if they just totally dismiss your concerns and make you feel like your expectations are unreasonable, think about getting a second opinion. You're not obligated to continue a treatment relationship with someone who isn't listening to you. So here's what I want you to take from this. Bad tear trough filler results are not always permanent. They can be fixable. And the path forward, whether that's dissolving and reassessing, or dissolving and doing surgery, or just dissolving and doing nothing, it's a lot clearer once you know which type of failure you are dealing with. Drop a comment and tell me about your experience. What were you hoping to fix? What did you actually get? And which of those 3 failure modes sounds like yours? If your problem sounds like it actually might be eye bags rather than just a little hollowness, I've got a full video on lower eyelid surgery linked right here. It's worth watching before you make any decisions. And if you'd like an actual evaluation, you can book a consultation with us at eyelid.pro/book. Subscribe for more. I'll see you in the next video.